Hey everyone, Dr. Mike here. Did you know your lips can indicate over a dozen health problems? Those things you use to talk, smile, and eat can also be sending you subtle signals about what's going on inside your body. Think of your lips like a window into your overall health. Today we're going to break down some common lip changes and what they might mean. Alright, let's start with the basics. Dehydration. We all know that water is essential, but did you know that one of the first places you'll notice dehydration is your lips? When you're dehydrated, your body conserves water, and guess what? Your lips are not a priority. That's why dry, chapped lips are a classic sign of dehydration. Just grab your water bottle and start sipping. Aim for that classic 8 glasses a day, and you'll not only quench your thirst, but also keep those lips looking plump and healthy. Now, if you're chronically experiencing dry lips, even when you're drinking enough water, it might be worth checking in with your doctor. There could be other factors at play, like certain medications or underlying medical conditions. Moving on to a less obvious culprit, vitamin B12 deficiency. One of the lesser-known signs of a B12 deficiency? You guessed it, lip problems. Specifically, a lack of B12 can cause your lips to become pale or sore. B12 is found in foods like meat, poultry, fish and dairy products. So if you're vegan or vegetarian, it's especially important to make sure you're getting enough B12 through fortified foods or supplements. If you're concerned about a B12 deficiency, don't hesitate to talk to your doctor. They can run a simple blood test to check your levels and recommend the best course of action. Let's talk about another common deficiency, iron. Now, we usually associate iron deficiency with fatigue, but did you know it can also manifest in your lips? Iron is crucial for carrying oxygen throughout your body, and when your iron levels are low, your lips might become pale or cracked. If you're noticing pale lips along with fatigue, weakness, and shortness of breath, it's a good idea to get your iron levels checked. Simple dietary changes, like incorporating more iron-rich foods into your meals, can often make a big difference. Think leafy green vegetables, lean meats, beans and lentils. Chapter 4. Allergic reactions, when your lips say no way. We all know that allergies can cause a whole range of symptoms, from sneezing to itchy eyes. But did you know that your lips can also be a target? Certain foods, medications or even cosmetics can cause allergic reactions that manifest in your lips. You might experience swelling, itching, redness or even blisters. If you notice your lips reacting after eating certain foods, using a new lipstick or trying a different laundry detergent, take note. It's important to identify and avoid the culprit triggering your allergic reaction. For mild reactions, over-the-counter antihistamines can often provide relief. But if you experience severe swelling, difficulty breathing, or any other concerning symptoms, seek medical attention immediately. Chapter 5. Cold sores, more than just a nuisance. Let's talk about a pesky lip problem that many of us are familiar with. Cold sores. Cold sores are caused by the herpes simplex virus, and while they're not usually a serious health concern, they can be a sign that your immune system is a little run down. While there's no cure for the herpes simplex virus, antiviral medications can help manage outbreaks and reduce their duration. Practicing good hygiene, like washing your hands frequently and avoiding close contact with others when you have a cold sore, can help prevent the spread of the virus. Chapter 6. Angular cheilitis. Don't ignore those corner cracks. You know, those painful cracks that can develop at the corners of your lips? That's angular cheilitis, and it can be more than just a cosmetic concern. Angular cheilitis can be caused by a variety of factors, including nutritional deficiencies, fungal infections, or even just dry mouth. If you're experiencing persistent cracks at the corners of your mouth, it's essential to figure out the underlying cause so you can treat it effectively. Your doctor can help determine if a nutritional deficiency, like a lack of iron or B vitamins, is contributing to the problem. In the meantime, keeping the corners of your mouth clean and moisturized can help prevent further irritation and promote healing. Chapter 7. Pale lips, a sign your body needs a boost. We've already talked about how vitamin B12 deficiency and iron deficiency can cause pale lips. Let's dive a little deeper into what else might be going on. Pale lips can also be a sign of anemia, a condition where your body doesn't have enough healthy red blood cells to carry oxygen to your tissues. Another possible culprit behind pale lips is poor circulation. When your blood isn't circulating properly, it can be difficult for your body to deliver oxygen-rich blood to your extremities, including your lips. If you're concerned about pale lips, it's essential to talk to your doctor. They can run tests to check for anemia, assess your circulation, and determine the underlying cause of your symptoms. Chapter 8. Swollen lips. When to worry, when to relax. Swollen lips can be alarming, but they're not always a cause for panic. Sometimes swollen lips are a simple allergic reaction to something you've eaten, touched, or inhaled. In these cases, the swelling usually subsides within a few hours or days, especially with the help of an over-the-counter antihistamine. However, if your lips swell suddenly and severely, or if the swelling is accompanied by difficulty breathing, hives, or other concerning symptoms, seek medical attention immediately. Beyond allergies, swollen lips can also be a sign of an underlying health issue, like an infection, inflammatory condition, or even certain medications. Chapter 9. Cracked lips more than just dry weather. Cracked lips are a common annoyance, especially during the colder months when the air is dry, but while dry weather can certainly contribute to chapped lips, it's not always the only culprit. We've already discussed how dehydration, vitamin deficiencies, and certain medical conditions can lead to cracked lips. Protecting your lips from the sun with a lip balm that contains SPF is crucial, just like you protect your skin from harmful UV rays. If your cracked lips are persistent or painful, or if they don't improve with over-the-counter lip balms, it's a good idea to consult with your doctor or a dermatologist. They can help determine the underlying cause of your dry, cracked lips and recommend the most effective treatment options. Now let's talk about a more serious lip symptom, blue lips, also known as cyanosis. While a slight bluish tint to your lips might be normal for some people, especially in cold weather, a noticeable blue discoloration often indicates a lack of oxygen in the blood. This can be a sign of a respiratory or cardiovascular problem, and it requires immediate medical attention. If you notice your lips turning blue, especially if it's accompanied by difficulty breathing, chest pain, or a rapid heartbeat, call 911 or head to the nearest emergency room right away. Remember, blue lips are a warning sign that shouldn't be ignored. Have you ever noticed your lips taking on a yellowish tint? While it's not as common as some of the other lip symptoms we've discussed, yellowish lips can be a sign of jaundice, a condition that occurs when there's a buildup of bilirubin in the blood. Normally, your liver filters bilirubin from your blood, but if your liver isn't functioning properly, bilirubin can build up in your blood and tissues, giving your skin and the whites of your eyes a yellowish hue. Yellowish lips, along with yellowing of the skin and eyes, can indicate a problem with your liver, gallbladder, or pancreas. If you notice these symptoms, it's essential to see your doctor promptly for a proper diagnosis and treatment plan. You might not think of your lips when you think of heart health, but believe it or not, there's a surprising connection between the two. Changes in lip color, particularly a bluish tint or a darkening of the lips, can sometimes be a sign of underlying heart problems. When your heart isn't pumping efficiently, it can lead to poor circulation, which can cause a buildup of deoxygenated blood in your extremities, including your lips. This can give your lips a bluish or purplish hue. If you notice your lips changing color or becoming swollen, especially if it's accompanied by other symptoms like shortness of breath, chest pain, or fatigue, it's essential to see your doctor right away to rule out any potential heart problems. Paying attention to changes in your lip color and texture can help you stay informed and proactive about your well-being. So there you have it, guys. Your lips are more than just a pretty face. From dehydration to vitamin deficiencies, allergies to infections, and even heart health, your lips can provide valuable clues about what's going on inside your body. If you're experiencing any unusual or persistent lip symptoms, it's always best to consult with your doctor for a proper diagnosis and treatment plan. Until next time, stay healthy and keep smiling.